right, it is time for our daily Health Watch Talk with Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir.
Likewise, Tim.
Okay, today we are talking about something that you described as sort of another viral fad, but I'm curious to learn more about it. Testosterone therapy, not for men, but for women. And the first thing I just wanted to get across, because I'm not sure a lot of you know that both men and women have both testosterone and estrogen in their bodies. It's just a question of, how many levels or what the levels are like for men and for women, right?
Yeah, that's right, Tim. So most people probably don't realize that women also produce testosterone. The main hormones in women are estrogen and progesterone, but testosterone is also produced much, much lower, though, compared to men. Men may have 15 times higher the levels than women. It's a social media phenomenon again. We've discussed some of these fads in the past, but we also have seen, Tim, over the last 10 years, from 2013 to 2023, data indicates testosterone prescriptions have gone up more than 50%. Some of this is because availability of testosterone it's easily available, med spas and telemedicine. And so, I guess it'll be important to talk a little bit about why.
You're right. That's what I was going to ask. I'm not familiar. What's at least the purported reason why women want to get more testosterone?
So testosterone is linked to libido, sexual health, energy levels, muscle growth, muscle buildup. And so in men in particular, but also to some degree in women as well. So we're seeing more and more women, especially when they hit the perimenopausal or menopausal age in the 40s, 50s, not only thinking or asking about hormone replacement therapy, but also testosterone too. And I just want to make sure folks understand, there's no strong data out there to support this from a clinical trial perspective. The FDA does not endorse using testosterone in women, and there is no medical association or medical organization that currently supports that either.
Okay. You had mentioned libido. That was the first thing that sort of rang in my head. Of course, whenever you're talking about, I hate to say it, problems that would tie to the bedroom, you get people's attention. And that means misinformation could be a little bit more prevalent there. So if there's no data that sort of suggests this works to help improve maybe low libido, what would you then suggest for a woman who is sort of looking for
Great
answers?
question. So there's an actual workup that needs to be done, both a medical workup, psychological, there is a stress, anxiety, other issues that may be going on, but also is there high blood pressure, diabetes, medical issues that may be contributing to something like this. So what I suggest, if you do have any of those symptoms or you've seen a drop in your sexual health, etc., then you should first of all go have an appointment with your internist or your OB, GYN, or a reproductive endocrinologist. One of these physicians you should seek out in terms of getting medical assistance.
And my last question, for the women who are taking testosterone therapy out there, are there any side effects?
There are, Tim.
Okay.
So, there may be a change in voice, a more masculine voice. And some of these side effects, by the way, can be irreversible, including hair growth, body odor, all these things that even when you stop testosterone, it all depends on how much they're taking. But some of these may be permanent, so things to keep in mind.
Interesting body odor in there. Guys, we stink. We got a lot of testosterone.
But hey, you have to be aware of all the side effects.
You do.
And not to mention, it may also have cardiovascular implications too.
Yeah, yes. And listen, body odor is nothing to be trifled with, even though I'm laughing about it. I'm being unprofessional. These are all real side effects. Please keep in mind just what Doctor said. There's just no data at this point to suggest.
Speak to a provider, your physician. It's like I said earlier, it's available widely now, telemedicine, med spa, but it's important you get a proper workup done.
There you go. Dr. Syed Hussain from Trinity Health of New England. Thank you so much.